Hi, my name is Chelsea, and I want to teach you how to live your most awakened and fulfilled life through motherhood. And that's my goal, that's my life mission. I wrote the book Mystical Motherhood that takes women step by step through the process of creating a conscious and happy family from conception to the early childhood years. And today I want to talk about postpartum depression. I know a lot about this because I worked in labor and delivery, and I'm also a certified family nurse practitioner, and have worked with women in clinics and with families in primary care clinics. And I specifically see this in my friends that need help, and they don't know if they're experiencing postpartum depression, or if the emotions they're feeling is just the baby blues, if what they're experiencing after they have a baby is normal, and why they're experiencing, why are they feeling overwhelmed. And it's a constant issue I see with my clients and with people in my life and with myself. It's really hard when you first have a baby and you feel isolated and you feel alone, you feel overwhelmed. You may feel like you're giving up your whole world for this child, and no one's teaching you how. Even if you have your mom there or your aunts, or even if you have a community, it's still something that's huge, and you're affecting the child. So you need to make sure that you're functioning at a high level and in complete alignment with a higher source in order to make sure the baby is also feeling that too. So it's more common to have postpartum depression if you had anxiety and depression before you had a baby. If you have a history of not coping well, if you have a history of a type A personality that's really anxious, that needs a lot of control in their environment, that doesn't cope well with life, really, it would be more common to feel stressed after you have a baby. If you had a traumatic birth, it's something that's really not talked about in the hospital. Oftentimes we would release patients with traumatic births and not even, it was missed, and it can get missed in the medical system very easily. And they'll just hand you a medication to say, oh, well, this will make you feel better, when it doesn't really get to the root of the problem, where the traumatic birth is important to release from yourself. And also, you need to get to the root of the problem of why you're feeling anxious. Like, do you need more food in the house? Do you need more support in the house? Do you need to feel less isolated? Do you need to reach out to a community of women so that you feel that you're being supported by, something bigger, and that you're not alone in this? All those things need to also be looked at and not just be handed a medication. I know this as a nurse practitioner. They just hand you these things and you take them, but you don't really know the effects of that and all the side effects it can bring. So it's good to know who you are as a woman, who you are as a mother, who you are as a parent, and your tendencies, and to heal that even before you have a baby. And in Mystical Motherhood, I teach women how to do that. But another thing that is not really commonly known is that in the yogic philosophies, if your hip bones aren't aligned, you actually, your system's off, just like your brain wouldn't be functioning. Your nervous system's off, your glandular system's off. So you're going to feel funny. And top of that, you already have hormones going. So you can Google something called Kundalini Yoga Kriyas. You can go to a chiropractor to have your hip bones realigned. Before you have a baby, it really helps the baby to drop. And also after you have a baby, just to get your system back in order. Another thing I have in my book, Mystical Motherhood, is a amazing meditation for depression. It's called Meditation for Dire Depression in the Postpartum section, or in the Postpartum Depression section of the book. That's an excellent meditation, very quick, 11 minutes a day. I'll teach it in another video. And you want to make sure you're doing enough self-care, which isn't just going to the spa and getting your hair done. It's about taking time in the morning to just breathe. It's about taking time for yourself to pray, to meditate, to look at what triggers you in your environment. If you are having postpartum depression, you need to reach out for help. If you're having postpartum blues, you need to reach out for help. If you feel like you're going into psychosis, you need to reach out for help right now. It is something that's not talked about in our society, but it needs to be addressed more, how overwhelming having a baby is. I have so many resources in Mystical Motherhood for you. I recommend actually also listening to mantras, something else I missed. You can find mantras online on YouTube. Google mantras, Google Kundalini yoga mantras. They're beautiful. They help to increase that happiness in the family and in yourself, and it makes the baby happy too. Hold the baby on your chest. That's another way to calm your nervous system and the child's. Find out more. Reach out to me at mysticalmotherhood.com. I'm here to answer your questions. I'm here to work with private clients all over the world. I'm here to create classes for you. Find my book online on Amazon, mysticalmotherhood.com. It'll take you step by step through the process of creating a conscious and a happy family so that you can live your best life and you can have the tools so you don't feel alone in this, because you're not. There's women all over the earth that are having babies and need help. I look forward to seeing you again. Please press subscribe if you like this.